Hi, it's Rachel from UWorld. Today we're going to be going over an interview question based on communication. Communication-centered questions may sound like, could you tell me about a time that you successfully explained a complex nursing topic to someone who did not have a nursing background? Or the question could be general and not specifically related to nursing. Remember that communication skills are used in many different settings. So it might sound like, tell us about a time that you gave a presentation that was well received. You want to show the interviewers that you can effectively communicate with many different types of audiences. So as a nurse, you want to remember that you're going to encounter people with various life experiences, medical knowledge, cultural backgrounds, and religious preferences. You want to show that you always consider these factors and tailor your delivery to the audience at hand. Consider how you might utilize resources like translators and educational materials to really help explain a difficult concept to a patient or a family member. You also want to demonstrate to the interviewers that you have a grasp on communication skills such as closed-loop communication and that you know how to ask clarifying questions. Finally, you want to highlight your ability to actively listen and show empathy. If you're interviewing for an active patient care job, these skills are especially important when a patient receives a life-altering diagnosis or is struggling to cope with a hospitalization. So what are some examples that you could use to answer a question like this? You could talk about how you have to explain a medical diagnosis or a medical concept to a patient or a family member that is non-medical. You could explain how you teach patients about healthy eating and how that can contribute or prevent certain disease processes. You can explain or hone in on a time during clinical where you had patients with a certain religious preference or a non-English speaker that you utilized a translator for. Remember, you really want to focus on closed-loop communication and clarifying questions. An example of this could be telling the interviewers that after a patient is given a new diagnosis and new medications, you make sure before discharge to ask them and almost quiz them, okay, can you explain to me how many times a day you're supposed to take your warfarin? Or can you explain to me what your new diet is supposed to look like and why? Again, you want to show the interviewers that you're prioritizing patient safety and the patient's knowledge so that they can go home safely and that you've used your nursing skills to really help them understand what's going on. This wraps up our video on communication. We hope you enjoyed it and subscribe to our channel for more content.